Welcome to Pride in Nursing and Midwifery Day today. Our theme is changing the way we change. The themes have run from the cradle to the grave. We've had presentations on infant feeding to organ donation. And it's all about nurses and midwives in their daily works, finding a way to change by winning hearts and minds and creating the purpose around why things need to be done differently.
Where we are now, some of the infrastructure that constrains us and the way the NHS has been built over time, that is legacy, that is history. But don't let that become the blocker for the future. And in some circumstances, rip up the agenda, do something different. It isn't always about the content of what you've done, it's the fact that you've done it.
Yes, absolutely.
That demonstration to our team and our colleagues that being different, doing it differently, thinking differently, challenging the status quo is what we really want and hope for our colleagues going forward, because that is how we're going to provide better care to our patients.
We really need to be a creativity, evidence-driven organisation. But it has to be the soldier ants, it has to be all the people out in the front line. They're the only people who can do it. Suzanne can't do it. Heather as a chief nurse can't do it. They can't be responsible for front level care. And at any hospital, trust will stand or fall according to how fabulous that front level care is.
The concept of change is something that I personally really enjoy and I like. But what equally I found out is that some people don't want to, and you have to really change your approach to getting them on board. Telling someone you're going to do this doesn't work. They don't sign up to it, they don't agree with it, and it's quite difficult to get them motivated along. But by changing how you introduce an idea, maybe getting them involved in the change process, it gets them more on board, and that your idea is more likely to succeed.
We want a whole generation of nurses and frontline healthcare staff who say, this is driving us crazy, why are we doing that? That's a complete waste of time, that's not working, why don't we stop that and do that instead? And we'll do it as a little trial. We'll keep data, we'll measure, we'll do a wee experiment, and after 6 months or a year, we will realise that system's better than that one, and we can stop doing that one.
It's about changing for us to fit into the new NHS, and we all talk about the having that sustainability, because NHS is completely different from what it was 10 years ago.
It's important to have change wherever you work, because you have to move forward with the times, and that's very important within nursing. It's always developing, and we have to keep moving with that to make sure that we're providing for our patients the best care we possibly can.
Having started the Chief Nursing Awards, I'm really pleased I did this, because this is about celebrating the excellence in nursing and midwifery in the organisation. This year what I've done is I have given an award for each commitment of the National Nursing and Midwifery Strategy. I was really thrilled as the day went on to hear people's recount of what it's like to nurse in today's world. And a lot of people were describing what it was like then and what it's like now, and why, despite what it feels like, you still should be proud to be a nurse.
Being a nurse, why would you go to nursing? Nursing is hard work. It is really hard work. But for me, it's not a profession, it's a vocation, and I cannot see myself doing any other job. I'm proud to be a nurse.
It's a pleasure to see what talent, what passion, what dedication we have in the organisation. And we really have a very special bunch of nurses and midwives in the hospital. And it's even greater for me to understand, as this is my last Pride in Nursing and Midwifery Day as Chief Nurse, how wonderful we are at delivering care to people who need us the most.